Heart valve disease is a spectrum of diseases that involves any of the valves that are in the heart. So the valves kind of function as one-way doors, really, that direct blood flow in one direction. And anytime you have either a valve that's not opening well or is leaky, kind of refers to that spectrum of diseases. So valve disease can happen in adults of all ages and children as well, but our focus is adults, but it's usually older people, so age 75 plus, but we see valve disease in all ages. Mitral regurgitation specifically refers to disease in the mitral valve, where blood flows backwards in that valve, which essentially results in the heart working harder to push blood in the right direction, but a lot of that's going in the wrong direction. The most common symptoms with mitral regurgitation are shortness of breath with exertion. So when walking, doing day-to-day activity, you can have lower extremity swelling or swelling in your feet, ankles. You can have swelling in your belly. You can have decreased appetite, so you're not eating as much. You can feel tired or fatigue. So it's a lot of different symptoms, but most commonly shortness of breath and swelling. So there's several options in people who have mitral regurgitation. So that involves replacing the valve surgically or repairing the valve surgically. The other option is to do a catheter-based procedure through the groin, through a blood vessel in the groin, using X-ray and ultrasound to really deploy a device that clips the valve leaflets together. So the standard of care in people who have valve disease due to wear and tear is surgery. In patients who are not candidates for surgery, we have the minimally invasive device that can help them with a lot of their symptoms. Each patient that we have that comes to us is managed by an entire team of physicians, nurses, and care providers. So the first step is the primary care doctor, who usually who hears the murmur or notices symptoms, and then orders further testing or refers him or her to the cardiologist. Then the cardiologist will further evaluate the patient to try to medically manage, get them on right medications, and then do other testing that's necessary, including an echocardiogram or sonogram of the heart, to really look and understand the valve to determine the next steps. Based on that, then the next referral would be made to a structural heart team or a valve team, which consists of a surgeon and an interventional cardiologist. Usually, if the patient's deemed a good candidate for surgery, then he'll go for surgery. If not, that's where we come in, where we, along with the surgeons, do the minimally invasive procedure together. So it's multiple people in a multi-step process to get the best result for the patient.